Welcome to the Brain Injury Association Waterloo-Wellington. This is our Tuesday night speaker series, and I'm going to ask Donna Henry to introduce our guests.
All right, so how many times do you think that in a day that you need to listen to or speak to somebody, how many times you need to read or write? If we tallied up all these occurrences, you'd soon discover that in every minute of your work, school, and leisure activities, you need to use this communication. Communication is essential for us to connect with one another and to connect with the world around us. So we have sound expressions tonight to do a presentation. So we have Jillian, we have Natalie, and Julie. So I'll turn it over to them and have them introduce themselves.
Great, thank you. So before we get started, I'm just going to share our screen and share our presentation with you. Can everyone see that? Yeah, good. All right. So tonight we've been asked to talk about speech-language pathology and what speech-language pathology might have to do with brain injury. And we want to share about our role, what we do, and how we might be able to help. A question people might ask is, well, if I don't have trouble with my R, why would I be going to see a speech-language pathologist? So we want to clear up some of that information for you tonight, and we're so grateful to have this opportunity. So I am Julie Venhuizen. So I am the owner of Sound Expression. We're a private speech-language pathology company here in Waterloo. We've been in operation since 2016, but prior to that, we've been in the community under a different name since 2001. So we've been here for quite some time, and we help all ages and all different communication difficulties. So I'll just say one thing. My name is Julie, and the thing I want you to remember to help remember my name is to picture a jewel. So I want you to keep jewel in your mind, or think of what a precious jewel might look like.
Awesome. And I'm Natalie. I'm an employee here at Sound Expression. I've been working here for just over 2 years now. Something I'm interested in is golf. I'm learning how to golf slowly but surely. And another communication disorder area that I'm interested in, aside from brain injury, is voice. We work with a lot of voice clients here. If they have any issues with their voice, or if they have a voice disorder of some sort. Oh, and my memory strategy for my name, sorry, Jillian. In order to remember the name Natalie, I want you to pair my name with the word nice. So nice Natalie.
And my name is Jillienne, and in order to remember my name, we're going to use a rhyming strategy. So you can remember Jillian Billion. Maybe you could picture a billion of me, and that could help you remember my name. And I'm also an employee here. I've been working here for about 6 years. And something about me is that I really love plants. And I've acquired quite a plant collection in the past few months. And my favorite communication area to work in is brain injury, but I also really enjoy working with people who have a fluency disorder or people who stutter. So what is speech-language pathology? We are professionals who help people with any sort of communication difficulty or swallowing difficulties. So some examples of communication difficulties would be, as Julie already mentioned, working with people who have trouble with a sound, like pronouncing the R sound. We also work with children and students who have difficulties with language. As Natalie pointed out, we work with people who have voice disorders or people who stutter. And then, of course, we work with people with brain injuries or people who've had strokes. Those are just a few areas that we work on with communication. And then we also see anyone who has any difficulties with swallowing, whether that be liquids or solids, and that could be due to numerous reasons, but we do see some swallowing difficulties in people who have brain injuries.
So as Donna already mentioned when she introduced us, communication is important. It's part of every aspect of our lives, and not a moment really goes by that we're not doing some form of communication. So I wanted to get you all involved just to demonstrate how challenging communication can be sometimes, and how important it is to get support if you're having any difficulties with communication. So now you don't have to participate if you don't want to, or it's something you can try on your own. But what I want you to do is, as a starting point, if you feel comfortable, I want you to look at this picture that's on the screen. You can see we've got some excitement coming next month across the border with the election. So all I want is one sentence to describe this picture, or what pops into your mind when you look at this picture.
So you're wanting us to unmute and then make the sentence. Okay.
Yeah, and just, yeah, say one sentence that pops into your mind about the picture that you see.
Okay, I'll start. I think this is a scary time, and those dates, I hope the stock market doesn't react too much.
Okay, anyone else want to take a stab?
I guess it's like unpredictable times.
Awesome.
I'm glad I'm not in their shoes.
Yes, that's a good one.
Absolutely. Does anyone else want to take a stab at it? I think, did Daryl say something?
Daryl, you need to unmute.
Yeah, you'll hit the microphone in the bottom left.
There you go.
I'm glad I'm not an American.
Yeah.
Very true statement. So now I want you to look at this picture, and I want to do the same thing. Can everyone see it? I know it's quite small, but this time I want you to say a sentence to describe the picture or the situation, but I want you to try to do it without using a word that has the letter N in it. So you can see it's another current events picture about what's happening with the virus. So this time I want you to say something about the picture if you feel comfortable doing so, but without including the letter N in any of your words.
Caring.
Good.
We must be safe.
Oh my, you guys are amazing at this.
Health care providers.
I thought this would be way harder. You guys are amazing.
Took me a while to think of a phrase, but yes, it is hard.
It is hard. It is hard, eh? And that is just a little snapshot of maybe what it might be like to experience a word retrieval difficulty. So that's one area particularly that we see quite often in people that have suffered a brain injury or a concussion of some sort. And it's one of those things that, you know, we just take it for granted. We have something to say and we go to talk, and then when things aren't working the way they should, and then the words don't come, it can be quite a struggle to get our thoughts and ideas out the way we want.
Okay, so along with word retrieval difficulties, we'll chat about the other things in the area of brain injury that we often see and work with. And we call these challenges cognitive communication difficulties. So some of these areas include understanding what people say. So a lot of our clients, when they do experience a brain injury, comprehending what someone says to them, or maybe something that is heard on a television, or even something that they read, can be challenging. Speaking is difficult as well. So that can be anything in terms of speaking fluently, making sure all of your words come out the way you intend them to. In terms of, it can relate to stuttering. It can also relate to losing your train of thought, losing your topic, or speaking too much, right? Speaking more than what you used to before the brain injury. Reading is also an area that we work on. So reading fluency, are you able to read the words themselves? And also reading comprehension. Do you understand, say, a paragraph after you've read it? Do you understand a chapter after you've read it? Do you understand the whole chapter book, right? So on a variety of different levels, reading can be a challenge after a brain injury. And memory ties in a lot with reading as well. So after reading, say, an email or a text from maybe a family member, do you remember what was said in that text a few seconds, a few minutes, maybe a day after it was sent to you? And similarly to that, writing is an area we target. So spelling can be affected after a brain injury. Proofreading is a big one too. So if you're writing an email, double checking it for spelling mistakes, double checking that you said your point the way you intended to. Social communication or social interaction is a really big area with brain injury as well. And that ties in a lot with verbal expression or speaking. So if you're speaking too much and not letting your communication partner engage in sort of a 50-50 interaction, that's something that we'll work on. Also, if you are not talking enough, right? If there's a couple awkward silences, perhaps you don't know, or you're having trouble initiating the conversation or thinking of what you want to say to this person in a particular scenario. We also work on nonverbal communication skills that fall into social interaction. So that encompasses things like, are you making eye contact when you are conversing with your communication partner? Are you showing the appropriate facial expressions? That's a really big one. Often after a brain injury, you may experience that you are using a flatter affect than you used to before, or perhaps too much expression in the sense that it may be interpreted wrongly or inappropriate for that context. And then lastly, we have thinking or cognitive skills required for all of the above. So this is things like attention, memory, organization, reasoning, even things like time management and planning ahead. Those are often impacted after a brain injury and tie into all the factors mentioned above. So understanding, speaking, reading, writing, and social communication. So for example, you need to organize your thoughts in a logical manner before you go to say something. So that's how organization would tie in with the speaking piece. And then on the next slide here, this kind of just summarizes all the areas I just talked about. And it's a nice visual because it shows the areas of the brain that can affect these specific areas that we work on. So you can see there's that cognition piece that's in the frontal cortex there. So we have attention, orientation, memory, organization, reasoning, judgment, executive functions. We have the communication side of things, which was the areas I talked about on the last slide. The physical side of things as well. So the muscle control, speech, voice, and stuttering. So after a brain injury, somebody may develop a voice disorder. Say they had maybe a trach inserted after an injury, and that may have damaged their vocal cords. So that's something we may work on. Or they may have experienced some sort of neurological damage that's affecting the movement of their vocal cords or their ability to produce fluent speech. Perhaps they have a stutter after their brain injury. And then we also have that self-regulation piece as well. So initiation, can we get a task started? Or is that hard for us now? Inhibition, stopping, right? Stopping ourselves when we're talking too much, stopping ourselves when we're perhaps feeling angry or frustrated. And then there's that anger control piece, stress, anxiety, and confidence. So lots of these areas intertwine with each other, but we all work on each one of these pieces.
So all of these difficulties that Natalie just went over, they can be apparent right after an injury. So you receive your brain injury and then you go home and you realize immediately that you're struggling with some of these areas. Or it can become more apparent as you start to return to your daily activities. So your daily activities could be returning to work or returning to school, returning to a social group that you attend, or returning to conversation with your family. And as you return to these activities, you might start to notice difficulties from the brain injury. And then the next point there talks about subtle cognitive communication difficulties. So sometimes we see clients where their diagnosis that they received at a hospital from a doctor says a mild brain injury. And a mild brain injury can still have a very significant impact on your daily activities. And a subtle cognitive communication difficulty could be difficulty expressing your opinion about something, or summarizing information from a meeting, or taking a phone message. Difficulties in all of these little pieces are not little, it's actually quite big. It can have a significant impact on your ability to work, go to school, and interact with your family and friends and people in the community.
So when you first begin the journey or the process of working with a speech language pathologist, the first part of the process would typically be for us to complete an assessment with the client to determine what skills might be of concern and what are the areas of strength with regards to the communication skills. And we would look at all of the areas that Natalie referred to previously, or we would fine tune the assessment and really just look at the areas that the client and their family might have identified have changed or of concern now. So if, say for example, reading is still the same as it was before, there would be no need for us to assess that area and to establish goals to work on that if that's not an area of concern for the person that's contacted us. And then at that time, we would also look at swallowing skills if there's any difficulties with choking or any concerns with food or drink possibly going into the airway and leading to maybe an infection or blocking the airway. And then once the assessment is completed, we would set up a plan for treatment moving forward, how to address the concerns that have been identified. And we set those goals in collaboration with the client themselves, of course, but then also family and you know, close supports that will be working and helping the person to achieve their goals. And we really look to be functional with our work. So we want to get a sense of, you know, what are the functional goals? You know, does this person want to return to work? Does the person want to take a course and you know, go back to school? Do they want to volunteer? And so then how can we support those difficulties and the communication skills within those settings so that they can be successful? And then another big component of the work we do is to make sure that we're collaborating with the team as well. So oftentimes there's a lot of different professionals involved, and so we'll want to work with everyone on the team to make sure we're all working toward the same common goals that the client has laid out and indicated that they really want to achieve in their work with us.
Okay, so what are functional goals? So functional goals are goals that help the person return to work, school, family interactions, social interactions, or activities in the community. So most of the goals, I should say all of the goals, we set as speech language pathologists after the assessment or even during treatment after when new goals are set throughout the treatment process. We work with the client to establish a goal that really targets something they are working towards, maybe in the long term or in short term, that really benefits their life. So an example of this could be presenting a school project to peers using some social communication strategies. So we do work with pediatric clients and adolescent clients, so this is a big one for sure. Another example of a functional goal could be improving how one proofreads their work emails before sending them, making sure we're being clear in that email and making sure we're spelling everything correctly too. And then lastly, topic maintenance. So making sure we maintain a topic when chatting with a friend as opposed to veering off topic so that the listener gets lost in what we're saying.
Can I just interrupt here for a minute? Is there ever a time when you think it's too late to work with somebody in that it's been a long time since their injury? How would they kind of get started and benefit from speech language pathology support?
Yeah, that's a really good question. And I find with brain injury, and this is especially a big one with not traumatic brain injury per se, but stroke as well, is there is a lot of, well, in the literature and a lot that is just said that after a brain injury, it's best to receive rehabilitation right away. And although it is best to get early intervention as soon as you can, any time is appropriate to seek speech language pathology support. A lot of what we do is rehabilitation in the sense that we work on exercises that target your communication difficulties or swallowing difficulties. But I would say most of what we do is compensatory strategies that work to help you use a strategy to work on something that may never improve per se, but that you want to help that particular skill. Is there anything you guys want to add to that?
Yeah, I would say, to be honest, it's never too late. So we have people on our caseloads that might be years post-injury. I'm thinking a client in particular is on my caseload right now is about 18 years post-injury. And while the gains are slow and progress is slow, there is successes within the functional goals that the client has outlined in collaboration with myself and other team members. So, and as Jillian mentioned too, sometimes the difficulties don't even become evident until, you know, months or even years down the road, depending on what the client is kind of reinitiating or getting themselves immersed in. And then maybe they're trying something new and all of a sudden they notice, hey, wait, this isn't exactly what it was like before. While we want to be realistic about progress, I don't think it's ever too late to get started if there's a concern.
Okay, great, thank you.
Mm-hmm.
Okay, so our next slide here has some examples of things that might happen in a treatment session with a speech language pathologist if you're seeing us for if you have a brain injury or a concussion. So some examples would be education. I do a lot of education just about what is a brain injury and what is a concussion, because I find it's very helpful for clients to hear that information. They've probably heard it earlier on after their injury, but it's helpful to hear it at different times throughout their progress. We also do a lot of education about what their difficulties are, bringing awareness to what is hard and what their strengths are. We might work on changing or modifying the environment. So educating the client to advocate for no background noise when they're doing certain tasks. So turning the TV off or asking people in the background to be quiet when they're doing a task. We might do some exercises to improve a cognitive communication skill or speech or swallowing. We provide opportunities to practice skills in different settings and with different people. So if you come to our clinic, you get the opportunity to practice with the speech pathologist that you see here, but you might also get the opportunity to practice with other people that work here in the office. So a newer communication partner to practice a skill, or sometimes we even go out into the community with our clients. So meeting at the mall or maybe at Tim Hortons when it's not COVID, and practicing skills in a new environment and with new people. We also, as Natalie mentioned, teach a lot of strategies to help compensate for difficulties. And Julie, in the exercise earlier, talked about word finding difficulty. So an example of a strategy for word finding would be description, describe the word. So that's just an example of a strategy. And then we also do a lot of collaboration with other people in the client's life to help them work towards their goals, and so that we can all be on the same page and support the client.
So just a quick question there. I'm the only caregiver on the group, but quite often if my spouse was trying to struggle for a word, I'd try and jump in and say that word for him, or correct his spelling, or like I used to do a lot of that. Now I don't, and I don't know which is better, to help save the conversation or to help that person learn some strategies to do that on their own.
Mm-hmm. That's a really great question. And I have a lot of those types of questions from caregivers or family or friends. And I think it's very individual to the client. So often I encourage them to have those conversations with the clients and see what they would prefer. Do you prefer that I fill in the word for you? Or do you want to try and do you want to use a strategy? And sometimes it also depends on the situation. So maybe if the person's out at the grocery store and they're struggling, maybe they want you to step in quicker and fill in the word than if you're just at home chatting.
Right.
I think it really depends on the person and the situation. And I think it's great if you can have open conversations about what the person prefers.
Okay, thanks.
And then, so this slide is just giving a picture of who else might be part of the rehabilitation team and who we might be collaborating with. So some of the professionals might be familiar and some of them might not be. So we work often with occupational therapists, and OTs often also do work on within the cognitive domain. So they're potentially helping clients with their memory and with other cognitive skills that are required for day-to-day functioning. So the way that we kind of separate from the work that OTs are doing would be that our focus is from a real communication perspective. So, you know, we can give strategies if someone, say, is always misplacing their keys, or, you know, they can't remember to do tasks. But a big focus of the work we do is also, you know, thinking, well, you know, is the person having a hard time remembering what someone says to them in conversation, or remembering what they want to say by the time their turn comes, and you know, really coming at it from that communication perspective. We also work collaboratively with physiotherapists, and that could be maybe even providing some strategies for the client to remember the exercises that they need to do for their physio program. And working with social workers and psychologists, the counseling piece, of course, can be pretty significant when it comes to developing the awareness of the difficulties, but then just even, you know, coming to terms with how life has changed since the injury. Case managers occasionally we work with, and you know, they help to make sure that the client has all of the team members in place that might be beneficial to support the recovery. Rehabilitation support workers we work a lot with, and they can be great supports as well as personal support workers to help carry over the goals and the communication strategies on a daily basis, sometimes between the sessions, and you know, making sure that the client is even able to try them out in the community, maybe when they're grocery shopping with them, or doing other errands, and supporting them in that way. And then there's other professionals as well. So optometrists, we see a lot of concerns with vision after accidents. And that impacts the reading from a physical perspective, and then we come at it from the comprehension side of things and the processing. And then we just wanted to give credit. Sheila McDonald is an incredible SLP in the community, and some of the information from our slides today were taken from a course that she offers to speech language pathologists, some extra training. And that is that sums up kind of a very broad introduction to the work we do. Does anyone have any questions at all, or any comments, or anything they want to share?
Yes. Sorry, I'm in the dark. Why can I speak normal around my family sometimes, majority of the time? And when I go out with friends and I'm people I do daily things with, I can't get my speech going. Did you get it?
That's a really good question, and this is not necessarily the answer you want to hear. It's hard for me to say exactly why that would be happening. There's a few different variables that could be at play, and one thing I should make sure I say before I keep answering the question is, as speech language pathologists, we're not allowed to diagnose. So it's not within our scope of practice to provide diagnoses that
Okay.
come from a physician or a psychologist. But we, within our role, we can do comprehensive assessments, and we can outline strengths and difficulties and provide that comprehensive analysis of someone's communication profile. So that is just kind of a little caveat there. But in what you're describing, it could be a comfort thing. So it could even potentially be from a psychological perspective. So with your family, you're comfortable, you're at ease, you're so familiar with them, kind of what they're thinking and what they're you've got that trust and that relationship. And maybe when you're out in the community, it's not as comfortable. So that could be one thing. It could also even be the environment. So maybe depending on the setting, when you're out with friends or in the community, maybe if it's really busy or there's a lot of background noise or other conversations going on at the same time, that can cause distraction and have a negative impact on the speech system. And maybe, again, I'm just guessing, but maybe in your home environment, it's more controlled and more quiet, and the distractions are minimized.
Okay, thank you.
Mm-hmm.
I have a couple of other questions that have come in. First of all, does the insurance provider usually cover your services?
That's a great question. Yeah, so if it's in the case of an auto accident, our services would be covered by an auto insurer if there's a claim open and there's rehabilitation benefits available for the person after the auto accident. We also have services that would be covered through WSIB. So we work with WSIB if the injury was sustained within the workplace. And then most extended health benefit providers do cover speech services. Often it's a very minimal amount that's covered within a calendar year, but there is often that coverage within extended health benefit plans.
Okay, I think that's answered the question. It's not, this person doesn't have an auto accident or WSIB, so extended health would cover a small amount of speech language. Okay.
Yeah, they'd have to look into the specifics of their policy, what
Right.
the max is per year, and if they need a doctor's referral to use their benefits.
Right. So it depends on each individual insurance plan then. Okay.
Got it. Yeah.
There's another question around stuttering. Are there some suggestions you have to help people with stuttering? And does stress have an impact on stuttering?
Sure.
Yeah, that's a great question. So to answer the stress question, yes, that is definitely a factor in many people that stutter, and stress can come from there can be all different types of stress, right? There can be stress that you feel maybe from a communication partner. It can be stress in the environment. It could be stress about the topic that you're talking about. All different types of stress can definitely impact fluency. And we have lots of different types of strategies that we teach clients to help with fluency. And it's usually very personalized to the individual and characteristics about their speech. So there's all different types of disfluencies that can happen. But so as Julie mentioned before, we would have to do an assessment to look at the types of stutters and then how best we can help. But one strategy that we usually give to most people is thinking about their breathing system and making sure that their breathing is adequate for their speech, and also pacing, so slowing down their rate of speech. So those are two strategies that we usually teach to most fluency clients.
Okay, great, thank you. I'm going to stop the video now, and then we can open up the chat for other questions. So hang in here.